Welcome to Breach Narrative, a channel where we uncover the real stories behind the world's most dangerous cyberattacks, data breaches, and digital crises. These aren't just tech failures. They are moments that quietly reshape governments, disrupt societies, and put real lives at risk. And today's story is one of the most disturbing examples of how close modern healthcare systems are to the digital edge. In early 2026, while ambulances raced through Belgian streets and hospital corridors stayed busy with patients unaware of what was coming, a silent crisis was unfolding behind computer screens. There were no alarms, no explosions, no visible chaos at first. But inside several hospital networks across Belgium, systems began to fail. Screens froze. Records became inaccessible. Communication lines slowed. And suddenly, lives were placed at risk not by disease or disaster, but by a cyberattack. Hospitals are meant to be safe spaces. They are designed to protect life, to heal, to respond in moments when every second matters. That's exactly why they have become prime targets in modern cyber warfare. The 2026 Belgium hospital cyberattack wasn't just an attack on computers, it was an attack on trust, safety, and the most vulnerable moments of human life. Reports later confirmed that multiple healthcare facilities experienced system outages linked to malicious cyber activity. Patient record systems were affected. Appointment scheduling collapsed. In some cases, emergency patients had to be rerouted to other hospitals because digital systems couldn't be relied upon. When hospitals lose access to data, doctors lose visibility. And when visibility is lost, decisions become slower and sometimes deadly. This attack followed a disturbing global trend. Healthcare systems around the world have increasingly been targeted because they rely heavily on digital infrastructure but often lag behind in cybersecurity investment. Medical devices, legacy software, interconnected networks, each convenience becomes a potential entry point. Attackers know hospitals can't afford downtime, making them ideal victims for pressure-based cyber operations. Belgian authorities moved quickly once the scope became clear. Emergency response protocols were activated. Hospitals switched to manual operations where possible. Paper records were pulled from storage. Staff were forced to work around digital blind spots, relying on memory, experience, and improvised workflows. In the background, cybersecurity teams scrambled to isolate infected systems and prevent further spread. While officials initially limited public details, cybersecurity analysts recognized familiar patterns. The intrusion showed signs of ransomware-style tactics. Systems disrupted, access restricted, pressure mounting. Whether or not ransom demands were issued publicly, the intent was clear: disruption first, consequences second. In healthcare, disruption alone is enough to cause harm. What makes hospital cyberattacks especially dangerous is their cascading effect. When one hospital diverts patients, others become overwhelmed. Emergency services face delays. Surgeries are postponed. Diagnostic results slow down. A single digital failure can ripple across an entire healthcare system within hours. Belgium's healthcare infrastructure is considered advanced by European standards, making the attack even more alarming. If a country with strong public services and regulations can face such disruption, the implications for less prepared systems are chilling. Cybersecurity experts warned that this incident wasn't an anomaly, it was a preview. Behind every cyberattack is intent. And in this case, intent mattered more than money. Targeting hospitals sends a message, it shows capability. It exposes weaknesses. And it reminds governments that critical services, once protected by physical walls, are now vulnerable through invisible digital doors. As investigations continued, officials confirmed no evidence of patient data being publicly leaked at the time. But the absence of leaks doesn't mean absence of damage. The real cost of healthcare cyberattacks is measured in stress, delays, and risk. It's measured in the moments doctors hesitate because systems aren't responding. It's measured in families waiting longer than they should. This attack reignited debates across Europe about cyber resilience in healthcare. Should hospitals be treated like military assets in cyberspace? Should healthcare infrastructure receive the same protection priority as energy grids and defense networks? And who is responsible when digital failures put lives at risk? One of the most troubling aspects of the Belgian hospital cyberattack was its timing. It didn't happen during a political crisis or a major conflict. It happened during routine operations when defenses were relaxed and systems were assumed to be stable. That's how modern cyberattacks succeed. Not through brute force, but through patience and precision. Healthcare workers were hailed as heroes during the crisis, not because systems worked, but because they didn't. Doctors, nurses, and technicians adapted under pressure, proving that human resilience still matters in a digital age. But resilience should never be a substitute for protection. As systems were gradually restored, the questions remained. Who was behind the attack? Was it financially motivated criminals, or something more strategic? And how many similar attempts go unnoticed every year, failing silently or succeeding without headlines? The Belgium hospital cyberattack of 2026 wasn't just a warning for Belgium. It was a warning for the world. As healthcare becomes smarter, faster, and more connected, it also becomes more exposed. And in a future where cyberattacks can delay ambulances instead of armies, the definition of national security must evolve. If you want to stay informed about the cyber incidents shaping our world often quietly, often without warning, subscribe to Breach Narrative. Because in an age where hospitals can become battlefields, understanding the threat is the first line of defense.